to continue with the strict measures of disinfection. For key population, for example, delivery men as well as the workers at the front line of logistics in the cold chain, and also for the key population working in the lockdown zone and the control zone, they have to wear the N95 masks. They also have to follow the routine of the mass nucleic acid test. For the people quarantined at home, they also have to respect all the rules of the quarantine and they should not leave their house. Present with us today, we have invited member of the leading group of Beijing against the COVID-19, Deputy Director of the testing team, and spokesperson Mr. Li Ang, Deputy Chief of the Government of District of Chaoyang, Li Beibei, and from Fengtai District, Cui Xulong, Deputy Director General of the CDC, member of the expert team against COVID-19, Madam Pang Xinhuo. They will share with us the latest development and also take your questions. First of all, I'd like to share with you the policies of the municipality of Beijing. Some measures about the district of Chaoyang as well as the other districts about the work from home. Friends of the media, since the 5th of May, in Chaoyang, Haidian, Fangshan, Tongzhou districts, those lockdown zones, control zones, and precautionary zones and temporary control zones, we have readjusted the routines of operation of public transportation. Within the regulated zones, people living there have to follow the guidance to work from home, and they have to make sure point-to-point transportation. They have to abide by the rules and avoid unnecessary traveling and visits. We also have to follow the guidance of work according to the joint mechanism. We have proposed 6 measures. First of all, for the government units as well as the SOEs, they have to make the leading role and urge their employees to work from home. And for people working from home, they can also become the volunteers at their community level. For the leading enterprises, in principle, they have to keep less than 50% on the working spots. For the working buildings, we also urge the employees to remain at their house and work from home. For workers that guarantee the basic services, they can continue to join their workplace. For those people who do have the need to go back to their workplace, they have to follow this closed-loop management, visiting no other places other than their home and the work unit. For the other places for entertainment, we urge them to suspend their operation. For the work units, they have to offer the guidance to their employees to facilitate their work from home. For those employees that have to be present at their workplace, they have to show their code of health. And for the working environment, the work units should disinfect on a regular basis. During the work from home hours, the salary as well as the hours of the rest, it depends on the communication and negotiation between the work units and also its employees. We should guarantee at least the minimum salary. We also have to pay attention to guarantee the basic rights and interests of the workers now working from home. If you have any problems or any doubts, you can make a phone call to the hotline. For the services and also micro and small businesses and individual owner of businesses, if they are renting a house or renting a property, then they can enjoy some preferential policies. For example, now they can pay less as the rent. We also have other supporting policies from the local government. For the administrative procedures, we have to make sure that we can maximize the coverage of the services through our online channels. For example, we have the online platform for the consultation, and also for the approval of necessary documents. To the maximum level, we can give a lot of conveniences to the work units and also to the people. For the management authorities, they have to strengthen the guidance, monitoring, as well as the inspection on all the working units inside their zones. That is the end of my briefing part. Now I'd like to give the floor to Madam Pang Xinhuo from the Beijing CDC. She will share with us the latest developments of COVID-19 outbreak and also give us notices about the upgrading of risks. Good afternoon, everyone. Now I'd like to share with you the number about the new local confirmed cases. Today from 0 to 15 hours o'clock, the new local confirmed cases 22. Since the end of yesterday's press conference, from 15 o'clock yesterday until now, new confirmed cases 39. Case 644 to 682. Fengshan district has 5. Fengtai has 4. Changping and Shijingshan district have 2 respectively. Daxing has 1. 3 general cases. Asymptomatic cases 5. 38 from the controlled zone, 1 from the mass testing. All of them have been transferred to the designated hospitals. For the other risk population, they have been put under the control. For the case 656 discovered through the mass testing, this case comes from the Xinhu residential region. After several rounds of nucleic acid tests, the case has negative results. And since the 3rd of May, he has displayed some symptoms, for example, lack of strength. And later, for the new round of nucleic acid test, there's the positive result. Here's the mild case. And for the source of the infection, we are still doing the studies. Since the 22nd of April, we have in total reported 544 local confirmed cases. For Tongzhou District, 58. Fengtai has 41. Haidian District has 23. Shunyi has 22. Shijingshan District has 13. Changping District has 10. Daxing has 9. Dongcheng has 5, and Xicheng and Miyun, as well as Yanqing, respectively 2 cases. Mentougou and Jingkai, respectively 1 case. Until now, we have already completed the sequencing of the samples from 222 confirmed cases. There are 2 confirmed transmission chains. And these 2 chains correspond with the transmission chains coming from the other provinces and cities. This latest outbreak has several features. For example, very fast spreading of the virus. There is still some latent sources of infection. We have not yet fully cut off the potential transmission chains. For all working units, they have to shoulder their responsibilities of the 4 parties. They have to urge the visitors to show their code of health and also ask everyone to wash their hands on a regular basis, put on the masks, and also abide by the rules of the social distancing. They also have to minimize the internal flow of the people in their workplace. If possible, they have to make the video conference or the video calls to accomplish their work. And it's also forbidden to have the dining services now in the public places. We have to carry out very good disinfection measures and also make sure there's very good conditions of the ventilation. If you enter the public places, you have to keep your hands clean and proper. You have to show and scan the QR code. You also have to show a negative result of the nucleic acid test. And you have to make sure you have the mask on, you respect the social distancing rules. Special tips for all the people. If you have ever visited the hospitals or the supermarkets, if you have ever touched the handles of the doors in the public places, please don't use the hands to touch your facial areas. Please do not touch your eyes or your nose. You have to wash your hands properly. Everyone should shoulder his or her responsibility and follow all the instructions. This is very important. Let's start from these tiny tips. Altogether, we can fully cut off the potential transmission chains in the end. That is end about the briefing about the local confirmed cases. Now about the upgrading of the risk classification. As of 24 o'clock yesterday, in Chaoyang district, the Panjiayuan residential area, for the last 14 days, we have in total reported 6 confirmed cases according to our evaluation and according to the classification of the risks in Beijing municipality. Since today, the Chaoyang district's Panjiayuan residential area will be upgraded to a high-risk area. As of 24 o'clock yesterday, in Shibalidian Township and Lujiaying Village, over the past 14 days, we have in total reported 6 local confirmed cases, and in Yanchun Township, Dazicao Village, over the past 2 weeks, we have reported 7 local confirmed cases according to the evaluation of the municipal CDC and according to the regulations of the classification of risks. From today on, the Shibalidian Township Lujiaying Village as well as the Doudian Township Yanchun Township Dazicao Village upgraded to the high-risk region. Currently, in the city, we have 17 high-risk regions, 31 medium-risk regions. That is all for my briefing today. Now, I'd like to give the floor to Madam Yang Beibei, Deputy Chief from the Chaoyang District. Friends of the media, good afternoon. Now, I'd like to share with you the updates of the work in Chaoyang District. As of 16 o'clock today, we have 16 local confirmed cases. Today, newly added risk points. In Dingfuzhuang, Laojia Noodle Restaurant and Dingfuzhuang Shanxi Noodle Restaurant, 26th of April. From 19 o'clock, the Shaxian Restaurant. On the 27th, 9 o'clock, supermarkets. 10 o'clock, supermarket near the Guanghuali. Panjiayuan Dongli residential area, building number 3. Jinsong South Road, Hanshi Supermarket. 9 to 20 in Dingfuzhuang, the restaurant for the barbecue. Guanghua Dongli residential area and restaurant for the Hubei dishes. Zhouzhuang Jiayuan Nanli residential places. 15 to 20, hotpot restaurant near the Hongyan Food Plaza. 19 to 20, seafood restaurant. On the 29th of April, 10 to 11, Xiaohongmen Village, Commercial Street, 11 o'clock, supermarket in Xiaohongmen Village. Recycling site by the Lujiaying Village, Commercial Street of the Lujiaying Village. Section C of the Zhouzhuang Jiayuan Dongli Residential Building. And Shanxi Noodle Restaurant, 20 o'clock, in Jianwai Langjiayuan Village. And supermarkets by the Jianguo Road, 8 to 9. The next day, breakfast shop and supermarket with Zhouzhuang Jiayuan, a Jiangnan building, from 13 o'clock. Supermarket for tobacco, Xiyandong Street. Fast food restaurant, 16 o'clock, Hongbo Jiayuan Residential Building. Supermarket, 17 o'clock, Hongbo Jiayuan second phase. Convenience store, 18 to 19, Guanghui Nanli Residential Building. Supermarkets for agricultural produce. 蜜雪冰城 from 华联长营 Shopping Mall. 长营天街永辉 BHG Supermarket. Nine to 21, 清水亭华北 Food Restaurant. KFC in Huachuan Plaza of Jiangnan Building. $11 o'clock, Jianguo Road, Lan Village, Supermarket. 11:45 to 11:50, Guanghui Nanli Residential Building. Supermarket for agricultural produce. 汇河南 Street, 顺福园 Supermarket. 13 o'clock, basketball field near the Xiaohongmen Village. 周庄嘉路 Road, convenience shop. 周庄中路 Courtyard number 7. And Hongbo Residential Building. Breakfast shop. 周家庄 Railway Station. 吕家营 Village Recycling Station. $20 to 21, Hongbo Jiayuan Phase 2. Ground floor convenience shop. On the 2nd of May, 9 o'clock, Lan Village, Suiyuan Xinglong Supermarket. 11 to 11 and a quarter, Xuhui Supermarket. 11 o'clock, Guanghuali number 6 Supermarket. 11 to 13 o'clock, Lejia Convenience Shop. In the second phase of Hongbo Jiayuan, convenience shop on the ground floor. On the 3rd of May, 9 o'clock, Hongbo Jiayuan Residential Building, ground floor convenience shop. Guanghuali Haircut, a barber shop. Nine o'clock, Guanghuali number 6 Supermarket. 洪博家园 Phase 2, Community Commission, 洪博家园 Supermarket for Agricultural Fresh Goods, 蒲崎 Buildings Convenience Shop. For the Jiangnan building, we have discovered more than one local confirmed cases. From the 26th of April until the 3rd of May, if you have ever visited this building, please report to the local commission. If you have also received the alert from the Beijing 健康宝 app, please also report it to the CDC or the local street community. You can also make a phone call to our hotline. For the settlement of the cases, we have carried out in-depth investigation, and also we have carried out epidemiological studies about all those cases. We have continued our work in a very precise and prompt manner. We have also done our best to discover all the possible risk population. According to the latest results of another new round of nucleic acid tests in the population, we have upgraded several places to a higher risk level. For the Guanghui Big Courtyard, Dalong Residential Building, Jianglong Building, and Huachuang Shopping Mall, Dawanglu No. 12 Courtyard, Supermarket, Dingfuzhuang, Horticulture Yard. We put them under the lockdown measures. In Gaobeidian Township, for the other areas surrounding the lockdown zones, they are classified nowadays as the controlled zones. We ask people not to leave the zone. For people now living in the lockdown zone, we urge them to not leave their home. For the temporary control zones, we have also made some readjustments. We have released information on the media platform. Please do not lower your guard, and you should not relax at this critical moment. Everyone should respect the rules and instructions and try your best to work from home and to not visit the workplace. And moving forward, we will also consider the results of the mass nucleic acid tests and also the trajectories discovered from the epidemiological studies. We will also keep you updated in the shortest delay. Second, we will continue with the mass nucleic acid test in our district. On the 4th of May, we have in total sampled 4.5 million people. We have discovered one tube with the mixture of 10 samples from 10 different people with the positive results, and we will continue with the in-depth study and repeat that test with that 10 persons in question. We have also created a lot of ambulant test sites. We have also created some fast tracks for the testing for students. After multiple rounds of mass nucleic acid testing, there are still some sporadic outbreaks at community level. It means that there are still some latent sources of the virus in the district, and more rounds of mass nucleic acid testing would be a very effective measure for us to discover and disclose all those hidden risks. We will try our best to guarantee the life necessities for our people. For example, the major producers of the life necessities and goods as well as the materials, they have guaranteed a large quantity of supply. We have also guaranteed the fresh fruit as well as the vegetables for the people, especially those living in the lockdown area and controlled zones. For the lockdown zones, we have helped to solve the problem of the last kilometer. For example, in the Shengli district, we have organized the inside services of the deliverymen. We have invited some of the deliverymen to go inside those areas and live there. For the people in want of the medications, we have also given them the services. We also have the 24 o'clock fast track services for the pregnant women as well as the other people suffering from chronic diseases. Starting by today, we have added 200 more designated Uber vehicles. As of 4th of May, in total, we have received 14,000 calls for medical services. It is our responsibility to carry out all measures to fight against the COVID-19. Today is the first day of resumption of work after the 5-day Labor Day holiday. Many people have decided to take their computer home and started their work from home period. Many people have started to learn the skills of work from home, and some have also tried their best to modify their at-home environment so that they could be enjoying a better environment for working from home. Everyone's contributing to this fight against the COVID-19. Everyone's setting a very good example for the rest to see. And we are united today. We bear in mind the big picture. Thanks to all of you, responsible people and residents living in our district, and also because we have a responsible government in our district, we have the confidence to win the battle against COVID-19. Now, I'd like to give the floor to Madam Cui Xulong, the Deputy Chief of the Fengtai District. Good afternoon, everyone. Yesterday, since 3 p.m. until 3 p.m., today, we have discovered 3 new local confirmed cases. The trajectory of the new cases, case 1, they are from the risk control zone. He didn't got a lot of chance to go outside of the residential area. Around 6 a.m., in the past few days, he joined the mass nucleic acid testing. He has visited the courtyard number 38 of the Dawu Caozi village. In the latest round of mass nucleic acid testing, he has demonstrated a positive result, and later he has been transferred to the designated hospital. For the case 2, every morning this case would do the jogging outside. On the 2nd and the 3rd of May, around 11 a.m., he joined the mass nucleic acid test. On the 3rd of May, apart from the evening jogging, he didn't leave the residential building. On the 4th of May, around 9 a.m., his family member has displayed a positive result of the nucleic acid test, so this case 2 didn't leave his home anymore. For the case 3, every day he would take a walk outside the residential building for about half an hour. Over the past few days, every day around 7 a.m., he joined the mass nucleic acid test. And he went out for the shopping for vegetables between 8 to 11 a.m. And when he discovered that his family member became a confirmed case, he didn't leave the household anymore. Case number 4, living in the Deshoubei North Street. He's already been put under the quarantine in a collective way. For the other people who have the close contacts with those above-mentioned confirmed cases, or you have already received the alerts from the app of Beijing Jiankangbao, please just make a contact with the local volunteers and also the representatives, the local community administration commissions. We know that after the discovery of the local confirmed cases, the following 12 hours would be the key period for us to conduct an epidemiological study. We have also formed a synergy together with the other departments, for example, the Department of Informationization Office. Altogether, we have traced back to all the past visits of the confirmed cases. We would like to realize an early discovery of all the possible cases. Secondly, in a very effective and prompt measure, we have conducted the 6th round of mass nucleic acid testing. We have increased the staff available to organize the nucleic acid testing. We have also set up some ambulance spots for the nucleic acid testing so that people don't have to walk a long distance in order to have the service. Today, we are building this tightened network for the coverage of nucleic acid tests. We have covered the whole population living in our district. And third, we have tried our best to guarantee the daily living of the people. During the Labor Day holiday, for the daily necessities, for example, the fruit, vegetable, dairy products, and eggs, we have already set up the emergency response mechanism in collaboration with the major suppliers of agricultural produce in our district. For the major supermarkets, we have also realized the docking mechanism. We have the concentrated and unified supply of goods for our people, especially those living in the lockdown zone and controlled zones. We have also elaborated a list of the names for the enterprises that could offer the fast food for the people. We have also made sure that the dining facilities can offer the dine-out services. That is all for my briefing. Now I'd like to give the floor to Mr. Li Ang, Deputy Director General of the Municipal Health Commission. He will talk about the nucleic acid test screening. Good afternoon, everyone. After 3 rounds of mass nucleic acid testing, we have today set up 9,180 sites of the nucleic acid testing. We have mobilized 30,000 and more staff of medics. As of 10 a.m. this morning, we have completed the nucleic acid test for all the people living in our city. Among all the samples taken, we have discovered 4 tubes with a 10-in-1 mixture of samples, delivering a positive result of nucleic acid test. We will continue with our studies and elaboration of the reasons. Altogether, we would like to showcase a synergy. Today is the last round of the mass nucleic acid testing in our city. We hope that all the citizens would collaborate with our side. Please join the nearby nucleic acid testing sites. For all the people that should be covered, we should make sure that they are covered. We also have to carry out all the necessary measures to urge people to avoid all the unnecessary massive gathering and to ask everyone to put on their masks. Again, we would like to say thank you to all the people that have showcased the comprehension and cooperation with the municipality. The floor is open now for your questions. And with the CNS, I have a question for Deputy Director Mr. Li Ang. The Hospital of Aviation has posted a notice saying that they will suspend all the medical services. Could you please give us more details? Yes, of course. In recent days, this hospital has consulted and treated 1 confirmed case. And this confirmed case has not respected the quarantine rules, and he then visited other departments inside this hospital. This has created the transmission risks among the other patients and medics. Before getting his own nucleic acid test result, this person in question has already left the quarantine zone. The hospital didn't respect the rule of the management of the closed loop. There are also some loopholes in the management circle. The hospital didn't shoulder their full responsibility. They have violated the stipulations of the laws of the country to fight against infectious diseases. Today, according to the requirements of upper authorities, we urge the hospital to immediately correct all the wrongdoings. We have also carried out some punishment measures against this hospital in question, and for those people responsible for the incidents, they will also be heavily punished. Our Municipal Health Commission has attached great importance to this case. In order to prevent the future possible risk of the nosocomial infections, we have already elaborated several measures and policies. For example, the pre-classification of all the visitors. And we urge all the hospitals to strengthen the weak links. And second, we urge all the hospitals to follow the example and strictly abide by the regulations and stipulations of the national law and the other policies and instructions. They have to set up the red line against the COVID-19 so that they can further lower the spreading risk of the COVID-19 virus. And thirdly, all hospitals have to strengthen their measures to phase out the risks of the nosocomial infections within the hospitals. For those hospitals with very weak measures in place, they will be called out and they will be punished. We have to stick to that basic red line. Only by doing that can we make sure the safety of all the medics and also the patients in visits. If you don't have any further questions, I'd like to declare the closure of this press conference.